Questions this morning about the two nurses being treated for Ebola right now. Both Nina Pham and Amber Vinson have been moved to hospitals with state-of-the-art isolation facilities. But we're now learning more about how sick Amber Vinson was when she boarded a plane recently, and ABC's Alex Perez is on the story.
The CDC now saying the second nurse to come down with Ebola after treating Thomas Duncan may have been sick before her flight home from Ohio last week when she first triggered a search for 132 of her fellow passengers. Amber Vinson was visiting her bridesmaids and planning her upcoming wedding October 10th through the 13th. During that flight back to Dallas from Ohio, we first learned she felt sick, officially diagnosed with Ebola on the 15th in Dallas. But now reports Vinson felt some symptoms as early as Sunday, October 12th, and rested for long periods of time while still in Ohio.
She said she felt funny, but nothing specific. We can't rule out that she wasn't ill for the time that she was here in Ohio.
Now, Frontier Airlines and the CDC are working to get in touch with all of the passengers who flew with Vinson on her first flight out of Dallas. This morning, for the first time, we are hearing from a Texas doctor who has treated all three Ebola patients in the United States. Speaking out to Dallas ABC station WFAA.
Were you scared?
I don't think I would say I was scared. I was cautious.
The doctor refuting criticism by some nurses that the staff was poorly trained and under-equipped.
I think we were just as ready as every other hospital in this country.
The other nurse in isolation with the deadly Ebola virus, Nurse Nina Pham, remains at the National Institutes of Health outside Washington, D.C. after being transported late Thursday from Dallas.
There's no crying. Well, happy tears are okay.
Doctors say Pham is very tired, but resting comfortably in fair condition, still separated from her one-year-old King Cavalier Charles Spaniel, also in isolation back home in Texas. So far, with no signs of infection, playing fetch with workers. Alex Perez, ABC News, Chicago.
Our thanks to Alex Perez. And for more, we want to bring in Dr. Anthony Fauci. He's the director of the National Institute of Allergy and Infectious Diseases, and he joins us from Washington this morning. Good morning, Dr. Fauci. And first and foremost, can you give us an update on the condition of Nina Pham, the Texas nurse being treated at Bethesda for Ebola? She is under your care, but you're saying her condition has gone from good to fair.
No, I think that's a misinterpretation. She was leveled as good when she was in Texas. When we saw her, we immediately worked her up, and we made our assessment that her condition was fair. That doesn't mean it's gotten worse, because you have two different groups. So their good may be our fair. I can tell you she's stable, she's doing well. I had long conversations with her yesterday. She's feeling okay. She still has a serious disease. She's making progress. We are pleased with her progress, but her condition is fair and stable, and she's comfortable and resting. But you got to remember, Ebola really knocks you out, and that's the reason why we're watching her very closely and giving her the best possible care.
Right. There's so many myths, truths right now about Ebola, but it can incubate for 21 days. It is worth noting that Thomas Eric Duncan's family is in day 20, and none have contracted the disease. So what does that say?
Well, I think it's important for the American public to realize that we have two cases of Ebola that were contracted here in the United States. And both of them were very brave and devoted nurses who were taking care of an extraordinarily ill person, Mr. Duncan. Those are the only two Ebola cases. That doesn't mean that other contacts might not get infected, but you just have to look at Mr. Duncan's contacts, his family members for which he had close contact, have not gotten infected yet. They're still not completely out of the woods, but they've not. So it is contracted by direct contact with body fluids, blood, vomit, diarrhea, just the way the nurses who put themselves in danger, bit of the risk.
Right.
It's risky for healthcare workers.
Dr. Fauci, thank you for studying the records. I know you've been up all night with some other patients, so we do thank you for your time this morning.
You're quite welcome.
And I just want to amplify such an important point that you made about Duncan's family not being sick thus far does speak to how hard it is to contract this virus.
Yeah, it is not an airborne disease, and that's why some who are calling for a flight ban, they're saying that's not going to work because this is only passed through bodily fluids back and forth.
But it's a great corrective to all the fear and in some cases panic out there in the country. We'll have much more coverage on Ebola, of course, all day long on abcnews.com.